Welcome to our channel, where today we delve into an important health topic: gestational diabetes. Misunderstandings and myths abound, often clouding the truth. In this video, we aim to clarify these myths, separating fact from fiction so you can be better informed. First, let's understand what gestational diabetes is. It's a condition that occurs only during pregnancy, where the body's ability to process glucose is impaired. This results in elevated blood sugar levels, which can pose risks to both mother and baby if not managed properly. It's essential to dispel misconceptions about this condition to ensure it's addressed with knowledge and care. Now, let's address the first myth. Gestational diabetes only affects women who are unhealthy or overweight. This is a common fallacy. While being overweight can increase the risk, gestational diabetes can develop in women of all shapes and sizes. Factors such as genetics, age, and ethnicity also play significant roles. Healthy individuals can, and do, encounter this condition. It is not a reflection of a woman's health choices alone. Moving on to the second myth. If you have gestational diabetes, your baby will definitely have diabetes too. The truth is, having gestational diabetes does not guarantee your child will develop diabetes. While children born to mothers with gestational diabetes may have a higher predisposition to type 2 diabetes and obesity later in life, this outcome is not predetermined. With proper postnatal care, monitoring, and a healthy lifestyle, many of these potential risks can be mitigated effectively. Next, let's tackle the myth that gestational diabetes will definitely require insulin injections. Not all cases of gestational diabetes necessitate insulin therapy. Many women manage their blood glucose levels through dietary modifications and regular exercise, keeping both mother and baby safe. However, in some cases, when lifestyle changes aren't enough, insulin or other medications may be prescribed. Treatment varies from case to case, emphasizing the importance of personalized medical advice. Another widespread myth is that gestational diabetes always causes large babies, leading to complicated deliveries. While gestational diabetes can increase the risk of having a larger baby, known as macrosomia, it doesn't guarantee it. With careful monitoring and management of blood sugar levels, it's possible to minimize this risk. Regular prenatal care and ultrasounds help track the baby's growth, allowing timely interventions to ensure a safe delivery. Let's debunk the belief that women with gestational diabetes have to go on a special and restrictive diet. The dietary changes recommended for gestational diabetes are not about restriction, but rather balance and moderation. It's about choosing the right carbohydrates, proteins, and fats to maintain stable blood sugar levels. Consulting with a registered dietitian can aid in crafting a plan that's both nutritious and satisfying, ensuring both mother and baby receive essential nutrients. Finally, there's the misconception that once the baby is born, the risk of diabetes disappears completely. While gestational diabetes usually resolves after childbirth, it does increase the risk of developing type 2 diabetes in the future. This underscores the importance of maintaining a healthy lifestyle post-pregnancy, regular blood sugar monitoring, and follow-up care to prevent or delay the onset of type 2 diabetes. Understanding gestational diabetes is crucial for expectant mothers and their families. By busting these myths, we hope to encourage informed discussions and promote effective management of this condition. Remember, early detection and proper treatment are key to ensuring the health and well-being of both mother and baby. Thank you for joining us today. We hope this video has helped clarify some of the misconceptions surrounding gestational diabetes. For more insightful content, don't forget to subscribe to our channel. Stay informed and take care.